The latest report on facility payment by the Social Health Authority, SHA, shows that respiratory diseases are among the leading conditions, accounting for the highest number of patients that are seeking treatment under the Social Health Insurance Fund. This trend continues to place increasing pressure on public health facilities across the country. The report was produced by Frida Okachi and voiced by Fatma Bugu.
The survey conducted between July 2025 and April 2026 indicates that respiratory tract infections, digestive system diseases and malaria are the most frequently reported conditions, and they generally incur relatively lower treatment costs. In contrast, maternity services, cancer, kidney diseases, cardiovascular diseases and injuries account for a larger share of healthcare expenditure due to the need for more intensive and specialized care. A health expert specializing in respiratory infections notes that these conditions include asthma and pneumonia, which continue to affect thousands of Kenyans, particularly children, the elderly, and people living in areas with heavy air pollution and crowded housing.
In fact, children under 5, the commonest cause of death in children under 5, most of under 1, is due to pneumonia, which is a respiratory tract infection, and it kills a lot. Pneumonia is worse in very old people and very young people, people over 65, and people under 5 years of age, most of 1 year of age. And it's commonly people who got some existing diseases that reduce their immunity.
Dr. Joseph says that 20% of patients seeking medical care are affected largely due to improper use of medication.
Anytime somebody got a small flu, as they call it, they go to the doctor or they go to the chemist and buy some antibiotics. So a lot of antibiotics is used or misused because of respiratory infection. It is an important, and particularly when the weather is getting cold and damp as it is now, then you have a lot of flu.
The report also shows an increase in hospital admissions due to the respiratory diseases, raising concerns over the availability of oxygen, ICU beds, and specialized respiratory care services in public hospitals. According to the report, approximately 949,608 hospitalized patients were covered by Social Health Insurance Fund between July 2025 and April 2026, indicating a growing burden on the health sector. The findings further show that higher-level hospitals received the largest share of healthcare payments, highlighting that specialized treatment remains concentrated in major urban areas such as Nairobi, Uasin Gishu, and Kiambu counties. Fatma Bugu, NTV.